Hey, Kiana. So here's our explanation about what's going on. Now, keep in mind, this is all just anecdotal based on what we talked about. It's not necessarily, we haven't really confirmed it with our full evaluation, but this is what we see, what it seems like is going on with your knee. Okay. So, like we talked about, the knee is usually the result of something. It's not usually the cause. So, typically, when there's knee pain present, it's typically the result of something from the low back and like a nerve or something like that, the hip having some weakness, or the ankle having some lack of mobility or lack of strength. Okay, so when we're looking at this model here, this again really crappy. We have anything in black is bone, anything in green is muscle, anything in blue is a tendon. Okay, so we're looking at our muscles here. We have our hip flexor here, which starts at the front of all five of our lumbar vertebrae, comes together and makes one muscle and goes to the hip. So that can actually make this happen. So it can flex your hip, obviously, or it can extend your back. So we'll see that this hip flexor, if there's weakness there, if it constantly feels tight, typically we have weakness there. And that can cause both low back pain and hip and knee pain. Okay. What happens there is if this is too weak, it causes you to get too much stress. It's going to make you compensate through your knee and your ankle. So you're going to put too much stress on the front part of your knee as you're walking because you're not able to flex your hip up as well. So you're having to drive with your knee as opposed to driving with your hip. Okay, so that puts a lot of stress on the front of your knee, and that can overuse the patellar tendon. Okay, so whenever you're looking at your tendons here, they are the bridge between your muscles and your bones. So your quad muscles are very strong. You've been doing a bodybuilding prep, so your quad muscles are very strong. The bone is pretty much immobile. It's not really going to go anywhere, hopefully. And so the bridge is kind of the tendon is kind of that bridge in the middle there. Okay, so your quad muscle is pulling and pulling and pulling, and if the tendon itself is not strong enough to withstand the force that hip flexor is putting on it, it can quickly get overused and overworked. Okay, so the tendon, you have to load it in a very specific fashion. It's not as vascular; it doesn't have as much blood flow as a muscle. So, like a muscle, you could just like do a bunch of bicep curls. You can pump a bunch of blood into your bicep. Your bicep will get real big. Your tendon doesn't work the same way. So you have to do more of a tempo load to it, or more of a sustained load to it. So just doing like isometrics or heavy eccentrics or something like that. That all helps to strengthen the tendon specifically, get that motor recruitment pattern to those fibers in the tendon, and helps to get it stronger. Okay, so that's kind of the first thing that we're talking about. Second thing we're talking about is you're having a lot of that inflammation in like the back part of your knee and kind of just generalize in the knee. So typically what we'll see when that happens is that the knee is getting an abnormal amount of force to it, or an abnormal direction of force to it. So your knee, your meniscus, and all the structures in your knee are uniquely designed to absorb compressive loads. So this motion here. So when you're running, squatting, walking, all that stuff, you could do this all day. It could pump inflammation in and out, no problem. It's used to that. That's what it's designed for. However, if we have weakness in the adductors here, or the glute med here, or both, in most people it's both, we'll see people, it'll put an abnormal stress on the knee. So the hip will you'll kind of start to walk with what's called a Trendelenburg, or we call it sassy hips here in the clinic, but we'll talk about that later. But your hip will kind of come out a little bit, and that's going to put stress kind of more in a diagonal direction. Same thing with the adductors. We'll see with people when they're squatting. If they don't have good adductor strength, as they go to come out of a deep squat, half of that movement is coming from the adductors. The other half is the glutes. And then there's other little muscles, but primarily those two, right? So if your adductors aren't strong, you're going to see that knee kind of whip out or do things kind of crazy, and that puts abnormal stress again through that knee. So that puts more of that shear force to the knee. So instead of having this motion here, you're going to have kind of this motion here. So you're getting a lot of shearing force. Your knee does not like that. So your knee is going to get inflamed, and your body's going to send a bunch of inflammation to that area, because your body doesn't really know if there's an injury present. It knows that there's some abnormal movement patterns going on, and it's like, something's not right. Let's go send some inflammation in there and try to heal it. So you'll see, especially when you're at rest, your body's going to see that you're at rest. It's going to be, okay, let's take this time to go heal ourselves. So it'll send a bunch of inflammation in there. Inflammation builds up in the knee, and you go to start walking, and you got to like limp a little bit to pump some of that inflammation out of there. Okay, so the cause of that typically is weakness here at the adductors and weakness here at the glute med. We try to balance those things out to where your knee is stable from both ends of the spectrum, both sides here, and you can get more of that compressive load and less of that shearing load through it because of the weakness here at these two muscles. So I know that's kind of a lot, but just let me know if I hope that makes sense. And let me know if it doesn't, and we can kind of break it down and talk a little bit more about it. But I hope that clears things up, and let me know if you have any questions.